ओके जी, बिस्मिल्लाहिर्रहमानिर्रहीम। अस्सलाम वालेकुम बच्चों, क्या हाल चाल है? उम्मीद है कि आप लोग सब ठीक होंगे एंड फॉलोइंग द रूल्स, ऑल द रूल्स ऑफ द टेकिंग necessary measures for the safe the hygiene. Okay, so today we'll start the lecture on heart. Acha, heart. Before starting the formally the lectures of heart, I will first give you the basic the common symptom of the cardiovascular disease is usually the chest pain. You know that, and chest pain. And one of the scenario for chest pain is that a 55-year-old man was brought in the emergency of PF hospital with complaints of severe chest pain radiating to left shoulder and left jaw with shortness of breath and profuse sweating. So he was. This is usually the sign and symptoms of a patient who is suffering from myocardial infarction. And but before we can diagnose a patient of myocardial infarction or any cardiovascular disease, we should know all about the structure, the functions of the heart, and the how the it works, and the cardiovascular system is functioning normally, and the any how a disease condition can disrupt all these normal functions. So the learning objective of before starting this heart, we should know that first know the physiological anatomy of the heart, and what is the why it is located, and what is the inner structure. And and the next learning objective should be the how cardiac impulse is generated and propagated in the heart, the electrical activity, because the heart has the property of automaticity, that it automatically generates its own impulse. So it is not a mechanic before the mechanical activity, and electrical current is generated from one part of the which is called the pacemaker of the heart, and that electrical activity is propagated throughout the cardiac muscle. So that how that cardiac impulse is generated and is generated and propagated is the next learning objective. The third is the mechanical events, which is following the electrical event, which is called the cardiac cycle. How after passing the electrical activity, how the heart pumps the blood into the general circulation. Now, the electrical activity is recorded, which is called the ECG, electrocardiograph. So you should know what is the normal pattern of the ECG. And if you know the normal pattern of the ECG, only then you can be able to diagnose different disease condition. So the abnormalities or any in the ECG you need to be taught. So these are the learning objectives: the physiological anatomy of the heart first of all, then the electrical activity, then followed by the mechanical activity, which is called the cardiac cycle, then the recording of that electrical activity in the form of ECG, and then the normal pattern of normal ECG, and the any changes taking place in the ECG during cardiac any disease condition. Now, first of all, the we should know that heart is acts as a pump to impart pressure to the blood and to establish pressure gradient for the blood flow. So, unless and until a pressure gradient is not present, the heart cannot pump the blood into the general circulation. So, all know that the heart beat at a rate of 72 beats per minute. So heart acts as a pump. Then is the second component of cardiovascular system is the blood vessels. Blood vessels, they are passageways for the blood circulation, and the length of the blood vessels is about 1 lakh kilometer or 60 miles, 60,000 miles. And in the blood vessels we have the blood, which actually the transport medium, and the total blood in our body is about 5 liters. And so the cardiac output is also again 5 liters per minute. It means that per minute about 5 liters of the blood will be pumped by the heart into the general circulation. So we have three components: the heart, which is acts as a pump, the passageway, which is the blood vessels, and the blood vessels are filled with the blood, which acts as a transport medium. Then the inner structure of the heart, you all know from your previous knowledge that heart has four chambers, two atria and the two ventricles. Now the atria and the ventricle on the left side is called the left heart usually, and the atria and the ventricle on the right side are called the right heart. Now they are connected to each other by the different valves. Now the left heart, which is called the left atria and the left ventricle, the left atria and the left ventricle are usually comprises of oxygenated blood. So first of all, the left atria receive the oxygenated blood from the lungs through two right arteries and two left arteries. So these right pulmonary artery and the pulmonary right and left pulmonary arteries are the exceptions, because these arteries they are brought about by the left and right pulmonary veins. So left and pulmonary vein are the only exceptions which contain the oxygenated blood. Usually you know that the veins comprises or contains the deoxygenated blood, but this is the exception where left pulmonary arteries and the right pulmonary veins, so left pulmonary veins and the right pulmonary veins coming from the lungs are carrying the oxygenated blood to the left atria. The left pulmonary vein and the right pulmonary vein, there are four veins, they are bringing oxygenated blood from the lungs after oxygenated into the left atria and then into the left ventricle. From left ventricle, the left ventricle pump the blood into the aorta, and this oxygenated blood is supplied to the general circulation. Now after passing to the general circulation, the oxygen being supplied to the tissues, and then the deoxygenated blood is brought back to the right side of the heart through inferior and the superior vena cava. The superior and vena cava. The inferior vena cava bring the deoxygenated blood from the lower part of the body, and the superior vena cava brings the deoxygenated blood from the upper part of the head and the neck into the right atrium. So now the from this deoxygenated blood from the right atrium enter into the right ventricle, and from the right ventricle through the pulmonary artery, this deoxygenated blood is pumped in, goes to the lungs for oxygenation. So just like vein, these are the arteries which are the exception. Usually the arteries carries the oxygenated blood, but in this case the pulmonary artery, the right and left pulmonary artery, carries deoxygenated blood to the lungs for the oxygenation. So the oxygenated blood coming from the lungs into the left atria, into the left ventricle, pumped through aorta to the general circulation. Then the deoxygenated blood comes back through inferior vena cava and the superior vena cava into the right atria, into the right ventricle. Through the pulmonary artery, the deoxygenated blood goes to the lungs for oxygenation. So this is all about the movement of the heart into of the blood into the heart and the chambers of the different chambers of the heart. Now there are two types of circulation: the systemic circulation and the pulmonary circulation. The extent of systemic circulation is from the left ventricle into the aorta and back into the right atrium is the extent of systemic circulation. When the oxygenated blood through the aorta goes to the systemic circulation, to the general the whole body, and then bring back into the right atrium, this is the extent of the systemic circulation, starting from the left ventricle and reaching up to the right atrium. This is the extent of the systemic circulation. Whereas the deoxygenated blood from the right ventricle going to the pulmonary artery to the lungs and back into the left atria it's called the pulmonary circulation. Now the difference between systemic and the pulmonary circulation, obviously it is a greater systemic circulation is a greater circulation because it passes through the whole part of the body, whereas the pulmonary circulation is called the smaller circulation, which passes through only to the lungs for the oxygenation. The pulmonary circulation, the extent of pulmonary circulation is from the right ventricle passing through the lungs and back to the left atria. So these are two types of systemic and the pulmonary circulation. Then we have the coronary circulation, which is the coronary arteries, which the vessels which are supplying the blood, originated from the aorta, and they supply the muscles of the heart itself. Those vessels which supply oxygenated blood to the heart muscle itself is called the coronary circulation. It is other than the systemic and the pulmonary circulation. Now, where actually the heart is located, it is present in the chest. It is present in the chest, inside the mediastinum. It is present between the vertebral column and the sternum, between the inside the between the in the chest, in the mediastinum, between the two lungs. It is located more two-third more on the left side and one-third on the right side, and between the vertebral column and the sternum. So it is, the heart is actually the first organ to start functioning in the embryo about 3 to 4 at the 4 weeks of gestation. And the circulatory system is a transport system where it is a, the heart is shape it is having a shape of, is a cone shaped structure, size of a closed fist. You all know that normally the size of the heart is like a closed fist. Its dimension is 12 centimeter long, 9 centimeter wide, and 6 centimeter thick, and about 300. Its weight is 300 grams, and it is resting on the diaphragm between the two lungs. It is, I told you that it is present inside the mediastinum, resting on the diaphragm between the vertebral column and the sternum. Now the heart is surrounded by the three layers. It has three layers. The heart not surrounded, it is having three layers. The heart wall is having three layers. The innermost is called the endocardium. The middle one, which is made up of the muscles, is called the myocardium. And the outermost fibrous layer is called the epicardium or the pericardium. Okay. So there are three layers of the heart. It is a hollow organ. Heart is a hollow organ. The wall of the heart, it is filled with blood, and so the wall of the heart is made up of three layers. The innermost layer, which is facing the blood, is called the endocardium. The middle layer, which is comprises of the muscle, is called the myocardium, and the outermost layer, which is the fibrous layer, is called the epicardium, which is also called the pericardium. Now the fibrous structure of the told you that we have two atrias and the two ventricles. The two atrias are called the atrial syncytium, because, and the ventricles are collectively called the ventricle syncytium. The atrial syncytium, why it is called syncytium? Because atria contracts prior to ventricular ventricles, so they called as a whole. Two atrias contract as a whole, so they are called the atrial syncytium. And the two ventricles, they contract as a whole at one time, a little later than the atrial contraction, so they are called the ventricle syncytium. Now the two atrias are separated from the ventricle, the two ventricles, by a fibrous ring. So there is no connection between the two atria and the two ventricles, only by the so this fibrous ring is act as an insulator. That fibrous ring between the two atria and the two ventricle is called the acts as an insulator. Now, what is the function of that fibrous ring between the two structures? Is that it provide the foundation for the valve attachment. The valves which are present between the two atria and the ventricles, and beyond the aorta and the left ventricle and the pulmonary artery between the right ventricle. So provide a foundation. So the attachment of all the four types of valves are present in this fibrous ring. Now, moreover, the second is that this fibrous ring between the two atria and the two ventricle provide is a point of insertion of the cardiac muscles. Third is this fibrous ring, it prevents the overstretching of the valves, so that whenever the cardiac muscles they contract or they relax, there is no overstretching of the valves, they do not tear. Third is that fibrous ring acts as an electrical stimulator. The electrical current cannot pass, other than the normal pathway, the electrical current cannot directly enter from the atria into the ventricles. So it acts as an insulator. So there are 4 points. The fibrous ring between the two atria and the two ventricles, they provide a foundation for the valve attachment. There is a point of insertion of the cardiac muscle, and it prevents overstretching of the valves, and also act as an insulator, electrical insulator, so that the electrical current cannot directly enter from the atria into the ventricles. Okay. Now we will talk about the valves later. First of all, we talk about the inner structure of the heart. So I told you that the heart is a hollow structure filled with the blood. So if we do the cut section of the heart, we see it ensures only one way flow of the blood because of the presence of the valves between the two atria and the ventricle. Then we have the muscles. inside the inner wall of the, we have the muscles which are called the papillary muscles attached to the, which are attached to the valves through chordae tendineae muscles. These are the papillary muscles. These are the papillary, inside of the wall, these are the papillary muscles which are attached to these valves by these string-like structures called chordae tendineae muscle, chordae tendineae. Okay? So these inner structure, if we see the cut section of the heart, we see these specialized muscles which are called the papillary muscles, which are attached to the valves between the atria and vessel through chordae tendineae muscle. Now these chordae tendineae act as a reins. The horses will keep hold the valves so that it may not prolapse into the atria. So it keeps the valves taut. And so we have chordae tendineae and papillary muscle inside. We have chordae tendineae. Because of the smaller opening, velocity through the aortic and the pulmonary valve exceed that through the AV valve. So the opening of the aortic and the pulmonary valves are narrow. So the velocity is more through the aortic and the pulmonary valves. So this is these are the right atrial muscle. This is the left atria. This is right ventricle. This is the left ventricle. This is right ventricle. These are papillary muscle, chordae tendineae, and these are the valves. Now to about something about the heart valves. There are two types of valves in the heart: the valves between the atria and the ventricle, and the valves between the ventricles and the aorta and the pulmonary valves. Now, those valves which are between the atria and the ventricles are called the atrioventricular valves. The valves between the two atria and the two ventricles are called the atrioventricular valves. Now, the one which is present on the left side between the left atria and the left ventricle is called the bicuspid valve. It's called the bicuspid valve. Because why it is called the bicuspid valve? Because it has three cusps. It has three cusps. If you see the cut section, we have three cusps. That is why it is called the bicuspid valve, or it is also called the mitral valve. So the valve between the left atria and the left ventricle is called the bicuspid valve because it has two cusps. This one cusp and two cusps, or it is also called the mitral valve. Now the valve on the right, between the right atria and the right ventricle, is called the tricuspid valve. Now why it is called the tricuspid valve? Because it has three cusps. Instead of two cusps, it has three cusps. So it is called the tricuspid valve. So this is the tricuspid valve on the right heart, and bicuspid or the mitral valve on the left side of the heart. And the second type of valves are between the aortic valve and the pulmonary valve. The aortic valve is between the left ventricle and the aorta, and the pulmonary valve is between the right ventricle and the pulmonary artery. Now these two are collectively called the semilunar valves. Why they call the semilunar valves? Because they have the structure of a half moon shape. The half moon shape like structure, that is why they are called the semilunar valves. So the bicuspid mitral or the tricuspid valve are called the atrioventricular valve. The semineural valves are between the ventricles and between the aorta and the pulmonary artery. So these are the total four valves present in the heart. So these are the semilunar valves in the aorta and the pulmonary artery. These are half moon shaped structure and which ensure the one-way flow of the blood. It does not prevent the reflux of the bag into the blood, because the regurgitation or of the blood is an abnormal condition. So usually it ensures the one-way flow of the blood. Now the atria. Now atria is a thin wall structure than the ventricles. Why does a thin wall? We see the cut section. The walls of the ventricles are usually thicker than the atria, because atria is called the primer pump. It has to pump the blood from the atria into the ventricles, whereas the ventricle has to pump the blood into the general circulation or to the pulmonary to the lungs. So the wall of the atria is thinner as compared to the ventricles. The atria lies above, behind, and to the right of its corresponding ventricles. Now, the functions of the atria, the first function of atria is a conduit function. It just conduct or transmit the blood which it receives from the through superior inferior vena, superior or inferior vena cava on the right side, and pulmonary veins in case of left atria. So it is a conduit function. Second is a reservoir function. It stores the blood when the valves between the atrium ventricles are closed, and when the ventricles are pumping the blood, it it collect the blood, it keeps the hold the blood in the atria unless the valves are open. So it has a reservoir function. Third function is the pacemaker. The pacemaker through which from where the electrical activity is originated is called the pacemaker of the heart, which is called the SA node. Sinoatrial node is present on the right atrium that acts as a pacemaker on the behind the opening of the superior vena cava. This is present behind the opening of the superior vena cava. Then the fourth function of the atria is that it has an endocrine function. Endocrine function means it secretes a hormone, right? Atrium secretes a hormone called the atrial natriuretic peptide, ANP. Atrial natriuretic peptide is a hormone which is released from right atrium, which increases the heart rate, and it is released whenever there is increased venous return. Whenever the body in our body increase blood volume, hypervolemia, increased venous return, more blood reaches the heart, this hormone is released from the right atrium, and it acts on the kidney so that the kidney will flush that excess water from the body. So what is the function of the atrial natriuretic peptide? It acts as a diuretic. Whenever it senses increased blood volume in your body, increased venous return into the heart, more and more blood is coming back into the heart. So it is released. It acts on the kidney and ensure the excretion of that excess water from the body through increased heart rate. So inhibition of it causes inhibition of reabsorption sodium from the renal tubule. The hormone is produced when there is sudden increase in venous return, and it initiates more secretion of urine. So this is one of the most important function of the right atrium. Now the last function is that the right atrium is responsible for the last 1/4 filling of the ventricles. Usually whatever blood coming into the right atrium is passively enter into the left ventricle, but the last 1/4 filling of the ventricle is because when the right atrium it contracts, it ensures the complete removal of that blood into the ventricle. So atrial contraction is responsible for the last 1/4 filling of the ventricle. So we have five function of the atrium, that it acts as a conduit function, just transmit the blood coming from into the left atrium. It acts as a reservoir function. It has a pacemaker SA node on the right atrium, the wall of right atrium behind the opening of the superior vena cava. It secretes the hormone atrial natriuretic peptide, and it is responsible for the last 1/4 filling of the ventricle. Before that, the filling of the ventricle is passive. All the blood that is coming back into the atrium are automatically being transported into the ventricle. Now the ventricles, which is actually the main pump. I told you that atrias are the primer pump, whereas the ventricles are the major pump. Now if you see the cut section, you see that the walls of the left ventricle is 3 to 4 times thicker than the right ventricles, because again, the left ventricle has to pump the blood against higher pressure. Because in the aorta, the pressure is very high, and against that higher pressure, the ventricles has to pump the blood into the general circulation. Whereas the right ventricle, in the pulmonary circulation, the pressure is much lower as compared to systemic circulation. So it has to pump again less pressure. So the walls of the left ventricle is 3 to 4 times thicker than the right ventricle. Then is left ventricle pump against the pressure of 120 millimeter mercury, whereas the right ventricle pump the blood against the pressure of 23 millimeter of mercury. Now the arrangement of muscle fibers in the heart. How the heart is a hollow organ, how the heart wall is made up of muscles, and what is the arrangement of the muscles of the those line making the walls of the heart. Now the muscle fibers are arranged in two layers: inner and outer spiral muscles. The three divided into three: the inner, middle, and outer. The inner and the outer are arranged in spirally arranged. follow oblique courses and perpendicular to each other, and the contraction lead to shortening of the ventricle chamber from base to apex. It means whenever these inner and outer spiral muscles they contract, it causes shortening from base to apex. Okay? Predominantly present in the right ventricle. Whereas the deep middle constrictor muscle fibers, they are present between inner and outer, in the middle layer between inner and outer layer, and the contraction of these middle constrictor muscle decreases the transverse dimension of the diameter of the ventricles, and they are predominantly present in the left ventricle. So deep middle constrictor fibers are predominantly present in the left ventricle, and the inner and outer spiral muscles are predominantly present in the right ventricle. So this is the structure of the muscles which are spirally arranged. When you, just like when you squeeze the your wet clothes, and they are in the same way, they contract the spirally muscle, they causes the shortening of the from base to apex or the transverse diameter. Now the second is the what are the pressure in different chambers. There are four chambers in the heart, two atrials and the two ventricles. Each is having the different pressures. So the highest pressure is called the systolic pressure. When the heart pumps, when the heart contracts, when the heart is contracting, there is increased pressure. That is called the systolic pressure. And when the heart is in relaxed state, that is pressure is called the diastolic pressure. So the systolic and the diastolic pressure of all the four chambers and the aorta and the pulmonary arteries are different. I again repeat, the systolic pressure is the pressure in the heart when the heart is in contracted state, whereas the diastolic pressure is the pressure in the heart when the heart is in relaxed state. So the systolic and the diastolic pressure of all the four chambers and the aorta and pulmonary artery are different from each other. So the right atrium, when it is in a contracted state, maximum of its pressure is 4 to 6 millimeter of mercury, whereas the diastolic pressure is 0. It falls to 0. Left atrium systolic may rise a maximum up to 7 to 8 millimeter of mercury, and the diastolic pressure is 0 millimeter of mercury. Ventricle, when it is pumping the blood into the right ventricle, when pumping the blood into the to the pulmonary circulation, into the pulmonary artery, the maximum pressure is 20 or 23 millimeter of mercury, whereas the diastolic pressure falls to 0. It means when it is relaxed, the pressure is 0. Whereas left ventricle, when it is contracted state, it may rise up to 120 millimeter of mercury, and the diastolic pressure is again 0. Now in aorta, when the heart is in contracted state, the systolic pressure is 120 millimeter of mercury, but the diastolic does not fall up to 0. It is 80 millimeter of mercury. So it is different. 120, 80 is the pressure, systolic and diastolic pressure in aorta, where it is 120 by 0 in left ventricle. Similarly, in the pulmonary artery, it is the systolic is 20 and diastolic is 8. So it is pulmonary artery is 20 by 8, whereas in the right ventricle it is 20 by 0. So you need to learn all these pressures in this during systole and during diastole. Now the heart, I've told you the outermost layer of the heart is called the pericardium. And the pericardium is again having two layers. The one which is facing the inner heart is called the visceral layer, and the one which is facing outward is called is called the pericardial layer. So in between the two layer, visceral layer and the um, visceral and the uh, pericardial layer. So the in between the two layer, this is the one which is facing the viscera is called the visceral layer, and this is one is facing the, and it's called the pericardial. The in between is a space which is called the pericardial space, and is filled about the fluid with a clear fluid about 5 to 30 ml fluid. Now the function of this pericardium double cerofibrous sac that surround the heart, it be at the base of the heart. Now one thing I have left, that this is the base of the heart. This is the base of the heart, and this is the apex of the heart, which is directed downward, forward, and towards left side. This is the apex of the heart, and this is the base of the heart. Base is directly upward, backward, and towards right side, and the apex is directed downward, forward, and towards left side. So the base of the heart, the base of the heart is attached to the great vessels. All the great vessels, you see that these great vessels, the pulmonary artery, they all originated from here. So they provide a base for the great vessels, whereas this apex is attached to the central tendon of the diaphragm. You know what is diaphragm? Diaphragm is a muscle which is between the thorax and the abdomen. It is a barrier between the thorax. You know that the lungs and the heart is in the thorax, and the abdomen and the thorax is separated by a muscle called diaphragm. It is a dome shaped structure which is separating the thorax from the abdomen. Now the apex is attached to the central tendon of the diaphragm, and this pericardial space is contained about 15 to 50 ml of the fluid, two layer in a visceral and outer parietal layer. Hope you understand. I again repeat that this is the base of the heart where give origin to all the big vessels, the pulmonary artery, the aorta, and all this inferior cava, inferior and superior vena cava, the pulmonary veins are attached to this, or the present on the base, where this is the apex. This is attached to the central tendon of the diaphragm. Diaphragm is just like a dome-shaped structure which is separating the thorax from the abdomen. So and the this is the in a visceral layer, the pericardial having two layers. The inner one which is facing the visceral layer, outer is the parietal layer. This is built with the fluid. And what is the function of this pericardial fluid? Fluid in the pericardial space act as a lubricant to avoid friction during movement of the heart, keep the heart in its vertical position. It prevents over distension of the heart. So in some cases, when the heart has to pump against high pressure, those patients who are suffering from blood pressure, in this case, usually there is cardiomegaly. The heart enlarges because the heart has to pump against very high pressure. In that case, there is cardiomegaly, the enlargement of the heart. So this pericardial fluid prevent overstretching of the over distension of the heart. It prevents the lubrication, prevents spread of infection from the lungs to the heart and vice versa. So any infection from the lungs may not enter into the heart, or any infection from the heart may not enter into the lungs. So these are the function of the pericardium. Now there are some abnormalities of the pericardium. First is the pericarditis. Inflammation of the pericardium is called, if there's any bacterial viral infection of the pericardium, is called pericarditis. Constrictive pericarditis or inflammation pericardium is replaced by a fibrous tissue. If that area is replaced because of infection, after inflammation replaced by a fibrous tissue, then it's called constrictive pericarditis. And accumulation of blood in the pericardial space is called cardiac tamponade. If instead of that clear fluid, that space, pericardial space, is filled with the blood, that is called cardiac tamponade. Then the cardiac muscle. Now the myocardium, which is the muscles which are making the heart, there are two types of muscles. The one, contractile cells, and the specialized type of excitable cells called the P cells. Now the heart is made up of two types of muscles, which is called myocardium. Those which are responsible for contraction are called contractile cells. Muscles of making the atria, the muscles making the ventricles are the contractile cells, which are meant for contraction. There is a specialized type of, the second is a specialized type of excitable cells called P cells. They are not very contractile cell. They are meant for the transmission of nerve impulse from the pacemaker throughout the whole muscle. Are called called the P cell. So we have two types of cells in the heart: the contractile cell, which are responsible for the contraction of the muscle, and the specialized type of excitable cell called the P cells, which are actually responsible for the transmission of that pathway through which the cardiac impulse is transmitted, electrical activity which is originated from the pacemaker transferred throughout the whole muscles. So these are two types of muscles. Now the cardiac muscles are arranged in the form of lattice work. And if we see the histologically, we see the cardiac muscle in the histology under microscope. We see the cardiac muscle. We have this striation-like appearance, just like the skeletal muscle. These are striated. These are striations, and in which there's branching and recombining and then spreading. Has actin and myosin filament, just like the skeletal muscles. Have low resistance intercalated disc. These are basically one cardiac muscle, second cardiac muscle. They are attached to each other by the intercalated disc. These are the silvery appearance is called the intercalated cells, which are actually the cell membrane, and they are low resistance. Why they are called the low resistance? Because the cardiac impulse can easily pass through, because in the intercalated cells we have the gap junctions. In the intercalated cells we have gap junction which allow the easy passage of the impulse from one cardiac muscle to the other. So this is one cardiac muscle, this is another cardiac muscle, this is separated by this, these intercalated cells which have gap junctions and desmosome, which allow easy passage of the cardiac muscle from one cardiac muscle further. So that is why two atria are called atrial syncytium, and the two ventricles are called the ventricle syncytium, because once the two atrials they contract as a whole. Once the cardiac impulse is generated, the two atrias contract as a whole like the syncytium, and when the impulse from the two atrias enter into the two ventricles they contract it to whole as a whole, because the impulse travels so fast that it allows the whole muscle to contract as a whole. So it has these intercalated cells have gap junctions. It is because of the gap junction which allow low resistance, easy conduction of the cardiac impulse to pass throughout the whole muscle at one time. Okay. Now, so I've told you the atrium, ventricle, syncytium, no gap section between atrium, ventricle, between the atria and the you have the fiber. I've told you there is a fibrous ring which prevent the easy conduction of from the direct conduction of impulse from the atrium and ventricle. Only it is the specific pathway through which the impulse can pass. Otherwise, directly the impulse cannot travel from the atria directly into the ventricles. Now the muscles we have abundant mitochondria, because the heart has to all the time keep on working all the time. So it has numerous mitochondria. About 40% of the cell volume is made of mitochondria. Keep on generating energy. Okay, now heart depends on aerobic energy. It needs an oxygen and it needs glucose to generate energy, and the fatty acids also need fatty acid. Not only dependent on glucose, dependent on the fat to have obtain energy. Cardiac muscle have abundant myoglobin to store oxygen and to facilitate oxygen transport to the myocardium. So there's just like hemoglobin in the muscles, we have myoglobin. Just like hemoglobin in the blood, which supplies oxygen to in the blood, the muscles have cardiac muscle have myoglobin, which store oxygen and facilitate oxygen transport to the myocardium. No new cardiac muscle is produced after infancy. So once the heart is formed, it cannot be regenerated. The muscles only hypertrophy. I told you why there's hypertrophy cardiomegaly, when the heart has to pump against very high pressure. In the hypertensive patients, the heart enlarges because the heart has to pump against a very high pressure. Now, the amount of energy that the heart converts to work during each heartbeat while pumping the blood into the arteries is called the work output of the heart, and the amount of energy per minute is called the minute work of the heart. Okay. So 70 to 90% of the energy is obtained by the oxidative metabolism of fatty acids, and 10 to 30% from other nutrients like glucose and lactose. So just like that, that in the brain, brain requires only glucose, but it is not like in the heart. 70 to 90% of the energy is obtained by the oxidative metabolism of fatty acid. Only 10 to 30% obtained by the nutrients like glucose and fatty acids. Okay, so this is all for today, and inshallah, please give me your feedback so that if you are understanding my lecture or not. This is my first experience. I don't know how whether I'm successful in delivering the lectures or not in the proper way or not. So I may be waiting for your feedback.